State of Texas, DSHS has informed public health departments that they have adopted a revised definition for COVID-19 probable cases.
So for confirmed case, it stays the same. You still just need PCR. But now they've added a probable case definition. So that still gets counted towards the case count. It's different. It's not confirmed. It's probable, but it's still a case. So at the end of this definition, there are 15 different options on how you could be classified as a probable case. Based on this diagram and what they report, there's a total of 17 cases now. One is still only confirmed because that was that original index case who then had all these contacts underneath in orange. And all the rest of them became probable, but they are still considered a case.
It has the potential to be a very significant event for us here in Texas and here in Collin County, as the state now has elected to adopt this new probable definition. If you have a subjective fever and you have a headache and you live in Collin County, you now meet the qualifications to be a probable COVID patient. It is remarkable how low the standard is now. Mm-hmm. If you have one of the major symptoms, you have a cough or you have shortness of breath, and you live in Collin County, then you can satisfy the definition for a probable COVID case. But I'm very concerned that we absolutely could see the numbers jump very rapidly in a way that actually is not indicative of what we're seeing here in the community in the public health department.
Welcome back, ladies and gentlemen. Welcome back to Questions for Corbett. I'm your host, James Corbett of CorbettReport.com, and today's question comes in via voice message from Tom in Scotland.
Hi, James. It's Tom from Scotland here. I'm a long-time listener, recent subscriber, and my question has to do with the seeming anomaly between the fatality rate, the COVID-19, comparing Europe and Asia. So where you are in Japan, it's currently 1,100 reported cases for 42 deaths. I make that with very rudimentary mathematics, less than 0.5% fatality rate. South Korea, 9,000 reported cases, 120 deaths. Again, that's maybe just over 1% there. And then you jump to the main ones in Europe. And obviously, the most obvious place to start is Italy with 64,000 cases and then 6,000 deaths. Big jump there. I think the official figure is around 8% fatality rate at the moment. Spain, 35,000 cases, 2,300 deaths. So something in the region of, 5-6% there. Now, the reasons given for this by the media are that, for example, the Italian population is a very old, aging one, and most of the people who have died have been above 70. Now, for such a big jump in the overall fatality rate, I'm not sure that we can take this at face value. What are your thoughts? Do you think there is any foul play going on?
Thank you for the question, Tom. I know a lot of people are asking similar questions at this time about death counts and the Italian mortality rate. Why is it off the charts? What's going on here? So let's break it down as much as we can with what is being reported and what isn't being widely reported. And we can take this even from fairly mainstream sources that are pointing out there are some deep and serious flaws in just taking these death numbers from Italy at face value. For example, The Telegraph, of all places, posted this article up about a week ago. Why have so many coronavirus patients died in Italy? And they were noting even at that time the discrepancy between the at least reported mortality rates between, say, Italy and China and Germany was quite large. Germany reporting a mortality rate at that time of about 0.4%, whereas Italy was hovering around 9%. Why is that? Well, as they go on to explain in this report, according to Professor Walter Ricciardi, scientific advisor to Italy's Minister of Health, the country's mortality rate is far higher due to demographics. The nation has the second oldest population worldwide, and the manner in which hospitals record deaths. The age of our patients in hospitals is substantially older. The median is 67, while in China it was 46, Professor Ricciardi says. So essentially, the age distribution of our patients is squeezed to an older age, and this is substantial in increasing the lethality. And it goes on to state that a study in JAMA this week found that almost 40% of infections and 87% of deaths in the country have been in patients over 70 years old. And according to modelling by Imperial College London, the majority of this age group are likely to need critical hospital care, including 80% of 80-somethings, putting immense pressure on the health system. Well, more on the Imperial College London study in a bit, but let's continue diving into these Italian numbers and what that means. I want you to reflect on what was just reported in that article because it's important, but it has been reported and then swept under the rug and not really taken into account when we get these startling record number of deaths in Italy. They can't get coffins fast enough. Well, hold on a second. We get this, for example, from offguardian.org talking about this Italian mortality phenomenon. They have a post. Italy, only 12% of COVID-19 deaths list COVID-19 as cause. Report shows up to 88% of Italy's alleged COVID-19 deaths could be misattributed. And they talk about the report, citing Professor Walter Ricciardi, in which he says, the way in which we code deaths in our country is very generous, in the sense that all the people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. On re-evaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one premorbidity, i.e. other type of disease. Many had 2 or 3. As Off Guardian notes, this has been reported widely. It was even in the Telegraph, and yet no one seems to be engaging with it. The president of the Italian Civil Protection Service actually went out of his way to remind people on the nature of Italy's fatality figures in a morning briefing on March 20th. I want you to remember these people died with the coronavirus and not from the coronavirus. What does this actually mean? It means that the Italian death toll figures could have been artificially inflated by up to 88%. If true, this would mean the total number of Italians who have actually died of COVID-19 could be as low as 700, which would bring Italy, currently a statistical outlier in terms of COVID-19 fatalities, well in line with the rest of the world. It means thousands of deaths currently widely attributed to COVID-19 and being used to justify the introduction of measures equating to medical martial law may not have died of COVID-19 at all, but of their serious chronic comorbidity, cancer, heart disease, etc. This statistic is not a secret or in any way controversial. It was in the Telegraph after all, but people seem to be ignoring it or reading around it or perhaps simply not understanding it. And those numbers that they're throwing around there, of course, are from the time frame of that article on March 23rd. If you want slightly newer and more official numbers, you can go to the actual Italian report in English from the Italian Health Institute. The characteristics of COVID-19 patients dying in Italy report based on available data on March 26th, 2020. But this, of course, isn't just about Italy. This is about that death number that's being flashed in front of your face every hour on every mainstream broadcast you watch. The death toll has risen by X amount today. There's a few things that I want to point out. One, just the general point that I want to make here, that I made in my recent article, The Things You Cannot Say About Coronavirus. Again, I hope you have read that article. I hope you have shared it with others, because I think it makes some important points. But I do make the point specifically in that article that I do not trust a single one of the numbers being reported about this outbreak. And there are many ways to interpret that statement. It doesn't necessarily mean that everything's a hoax, but it certainly does mean that there's, even within mainstream land, even in the most mainstream circles, there are people trying to blow the whistle about some of the shenanigans that are going on here. And I make that point specifically in this article where I write, why listen to James Corbett, conspiracy theorist, or those silly Italian government health advisors on this matter? Well, I'm not alone in this suspicion of the official numbers. It turns out the Our World in Data research group that has been attempting to keep track of the coronavirus numbers has stopped using the World Health Organization's data because we found many errors in the data published by the WHO when we went through all the daily situation reports. Even within very mainstream circles, there are people trying to blow the whistle and say these numbers are not being reported in a way that will even be meaningful to you. Once again, it is not James Corbett saying that, it's Yahoo or Bloomberg via Yahoo Finance. Confirmed coronavirus cases is an almost meaningless metric.